Hi there everybody, and welcome back to Radfield Home Care's Coronavirus Focus. In today's episode, we're going to be looking at the impact coronavirus has had on client services, the safety of clients, and how it's impacted new clients wanting to take on care services. So I'm joined today with Hannah MacKechnie, our founder and franchisor, to discuss exactly that. So Hannah, welcome to today's episode.
Thanks, Ed.
Not a problem at all. So a bit of a starting point then, at a high level, how has coronavirus impacted our client safety?
Well, we've been working really hard at Radfield to make sure that we've been communicating really clearly with all of our clients. So taking the latest government guidance, interpreting that, making sure that we're communicating very, very clear messages out to our client base, especially as the rules have changed. For adult social care, those rules have been continually updated throughout the coronavirus outbreak. So making sure that our clients have got the latest information to help keep them safe. So primarily communication has been a key tool.
Okay. And what about PPE? Because that's been a big thing in the news, and it's probably one of the main things that people know about when it comes to coronavirus and care. Has that played an important role in that client safety piece?
Absolutely, yeah. PPE completely vital for our carers to be protected properly, not only for their own safety, but also to protect our clients who, in the main, do tend to be elderly, and many of whom would also be shielding or be in that vulnerable category. So PPE has played a very, very key role in that. So normally we would use PPE anyway when we're delivering personal care services. Yeah. But due to coronavirus, that PPE requirement has stepped up. So now our carers are wearing face masks as well. They're wearing face visors, and just making sure that obviously there's continual hand hygiene and use of hand sanitizers, etc., to keep both our clients and our carers safe. Okay, brilliant. And how about monitoring clients, making sure they are still well and they maybe aren't showing any symptoms of coronavirus? How has that been managed? Well, the technology systems that we use have been a really key tool in making sure that we're able to not only communicate with our clients, but also monitor their well-being and their health status. So that's been a really key way to ensure that our client base, we're able to monitor them for any symptoms and just ensure that they're getting those key messages, and that our staff are following all of the requirements and the guidance at all times as well. Yeah,
brilliant. So I imagine some clients, particularly probably at the start of the outbreak when it was very much in the media and there's a bit of worry amongst the general population, I imagine some clients were perhaps a bit wary about receiving care services. Did you find that was the case? Has that had an impact on the amount of services and clients that our franchise partners have?
Yeah, it was actually quite interesting at the beginning of the outbreak, because we look after a lot of clients across our network who just have very low level care needs. They primarily just want some companionship. So actually at the beginning of the coronavirus outbreak, we were contacting those clients to say, do you actually need our care services at the moment? You know, we were just very, very mindful that we needed to keep people safe. So we actually didn't want to expose them to unnecessary risk. And the interesting thing was that actually the majority of those clients greatly value the companionship and those associated services, so taking them out and about, doing the shopping for them, those sorts of needs that they had. They greatly value them, and they didn't actually want to relinquish those, even though we offered to keep the service available to them and then just pick up, just really defer it and then pick up again. So interestingly, we didn't really see that much of a sort of fallback with clients wanting to shield. And obviously because we were communicating well with them and using the PPE that we've discussed, it meant that they felt safe to carry on as well with the care services. And really what we've seen is, as discussed on a previous focus, recruitment has become a lot easier. Lots of people are looking at the care sector and wanting to join the care sector. So actually, through greater recruitment, we're actually able to take on more client inquiries that we've experienced over the last weeks and months. Okay, brilliant.
So it remained fairly steady at the start, and we've continued to grow, take on more clients.
Throughout.
Brilliant, fantastic. And what about now then? We're sort of on the back end, so to speak, of the peak of coronavirus. What are inquiries looking like? Are we getting more inquiries now than during or even before coronavirus?
I would say absolutely. I think the client inquiry levels have certainly return to pre-corona levels, if not more. I think primarily because the home care sector has been so much in the news lately that actually a lot of people weren't particularly aware of home care companies and what services we can provide and offer. So actually through that greater exposure of the sector, I think a lot of clients or their family members, and also through coronavirus, the family members may not have been able to visit elderly clients. So they've had to rely on services such as Radfield's to be able to provide that peace of mind that their elderly loved one is okay and they're being looked after, and you know they can really get that sense of making sure that they're safe and well at home.
Okay. Brilliant. So hopefully that's given you a bit of an insight into the impact coronavirus has had on the delivery of home care services to clients and how we manage to keep them safe. If you have any questions about the services we deliver, the recruitment of staff, or the overarching impact of coronavirus on Radfield Home Care and home care businesses, you can send across your questions to franchise@radfieldhomecare.co.uk, and we will discuss those in upcoming episodes. However, join us again next week when we will take a deeper dive into the impact PPE has had on how we deliver services and keep our clients and staff safe here at Radfield Home Care. See you then next Friday at 1 o'clock.